So unfortunately in America, half the people have high blood pressure by the time they're about 60, and about 75 to 80% by the time they're 75 or 80 have high blood pressure. And you wonder, why is that? You know, part of it is nutritional, part of it is our environmental. And there are certain diets that can delay, decrease, or be used in treatment of high blood pressure. And I'm sure you've all heard of low salt, but maybe many people haven't heard that calcium, a diet low in calcium can contribute to high blood pressure. And we need calcium for our bones, but we also need it for appropriate function of our blood vessels and relaxation of our blood vessels. And so high blood pressure is when the blood vessels constrict relative to the amount of volume that's in the body. Because we developed to be able to survive, let's say, an injury. And during an injury, sometimes there's hemorrhage, traumatic injury, hemorrhage. Well, what happens naturally is that the blood vessel constricts to prevent the person from bleeding to death, if that's possible, depends on the wound. In any case, that constrictive response becomes overactive and gets triggered by stresses also. Adrenaline can cause a constrictive response. So chronic stress, chronic adrenaline, combined with a high volume, because if the blood volume, salt and water basically elevates our volume, that can lead to high blood pressure. Well, transient or temporary high blood pressure, that's actually a normal thing. When you exercise, your blood pressure goes up normally. When you're under threat or in a fight or in an argument, your blood pressure goes up normally. Firefighter, a police officer, you know, they're out there in the field, blood pressure is normal, then it comes down. People with high blood pressure, after a while, that blood pressure doesn't return back to normal. And so that's an adaptive response to the blood vessels to prevent the high blood pressure from hitting the brain, causing a stroke. But eventually, the blood pressure is chronic, so we use medications to try to relax the blood vessels, or some other ways to try to decrease the constriction.